name is Helen Magdalenos, and I'm a certified child life specialist here at the Montreal Children's Hospital. I've been in this role for 20 years now. Our goal is to ensure that families and patients are adapting to their medical experiences, whether it's on an inpatient like mine or whether it's in the outpatient setting. Our goal is also to help the family and the patient understand who they're going to see, what's going to happen during their admission, and also come up with strategies to help it be the most adaptable experience to the hospitalization. When you saw me doing my morning report, that's when I get a lot of information on what's going to happen during the day. I'll speak with the nursing team. They'll signal any concerns. For example, if a patient had a difficult night's sleep. So that teamwork that we do in the morning really helps me and the nurses come up with a plan. I speak with the patient to bridge the gap about what time we're going to go, what our plan is, how are we going to help you get through this challenging experience or something that you've been through many times but you need some support maybe, and we're going to work together to make this the most positive experience possible. And the message I always say to the children we're working with and the teenagers we're working with is that they're the captain of our team and they help guide us and how we can do our job best. So they can tell us when they need a break, they can tell us if it hurts, and they're an important key person in making this the best possible experience under very challenging and difficult circumstances sometimes. We strongly believe that if you can prepare a patient, that if you can provide them with tools to adapt and to cope better with the experience, that overall it'll be less traumatizing and will be a better experience for the patient and the family.
My name is Gabriela Bofice. I'm a certified child life specialist and I'm pretty new here. I've been here for 6 months. So I work in the pediatric testing center. I'm flagged for children who are neurodiverse or who have just like a fear of the procedure. We're here really as support. So a lot of my role is making the assessment in the waiting room, approaching patients who maybe would require a little bit of help. I'll see how they're feeling, if there's anything that I can do to help support them. For a lot of the patients, I think it's a lot of uncertainty that kind of leads them to feel uneasy. So if that's the case, I'll work with them and I'll meet something that's at their level. A lot of times it involves medical play or just desensitization. So depending on the kid, I might bring out a teddy bear. I'll show him all of the steps of the procedure. I'll have the real equipment that we use that the kids can safely manipulate. And we'll go over all of the steps together. We'll stop along the way, ask, how do you think the bear is feeling? Just so that we see, you know, maybe it's kind of a projection of how the child might be feeling. And in that way we can say, what do you think would make the bear feel a little bit better? A lot of times it could be kind of facilitating deep breathing. So after we come up with a plan with the patient and the families, I'll come in to the testing room and I'll find a technician who's available. We'll have a clinical discussion, so I'll share with them all the concerns that the parents had and I'll share, most importantly, the plan. I'll make sure everything is set up before the patient enters the room just so that they know that their wishes were respected and everybody knows exactly what it is that this patient wants. We also try to make the waiting room a little bit more inviting, so we have a lot of toys available for normalization just so that kids can get kind of their mind off of things before their blood test. We also set up a big board. We call it like our affirmation station, where kids can say how they're feeling and just be kind of affirmed. So there's, you know, I'm confident, I'm strong, I'm brave, and I'm loved, just so that if they need that little boost, they'll have their little boost. Overall, I would say that it's super important that the kids feel respected and heard. For a lot of people, we might just think, you know, it's just a poke, but for some kids, it's not just a poke, it's a really big kind of mountain to climb. And for some kids, this might be the first poke of many. So we want to make sure that they're feeling okay, they're feeling like they were able to overcome it, and if they weren't, that's okay. These are the steps that we made to help them feel more comfortable. No one's forcing them to do anything. We're really following their lead, and it's always, you know, one step in a journey. It doesn't need to be the end right away. Every time kids come, it's always something different. We see how they're feeling, and you know, they all have different trajectories, but overall it's just to kind of minimize the stress, promote coping, and just you know, facilitate positive healthcare experiences.
Bonjour, je m'appelle Nathalie Majard, je suis conseillère en milieu pédiatrique. Présentement, je travaille principalement à l'unité de médecine, qui est au 9e étage. Par contre, aujourd'hui, je travaille pour le programme de zoothérapie. On accompagne le chien et l'intervenant pour rencontrer des patients qui ont été sélectionnés par mes collègues qui pourraient bénéficier le plus de la présence du chien, mais de la zoothérapie là, en général. Ça fait une immense différence pour les patients qui sont habitués de recevoir le chien. Ils attendent le chien. C'est un peu comme un ami qui vient les visiter une fois par semaine, dans le cas de Yuki. Leurs yeux s'illuminent, puis ça les réconforte, ça les calme. Ça leur permet de vivre une expérience très positive à l'hôpital. Alors, ça leur permet de collaborer bien avec les soins de santé, ça leur permet de... C'est un moment juste pour eux qui les gâte. Alors, ça fait une immense différence dans la vie de ces enfants-là qui attendent d'avoir le chien et qui sont très, très heureux de le voir. Dans le cas de la patiente qu'on a rencontrée aujourd'hui, c'est une famille qui n'avait jamais eu l'occasion de rencontrer un chien avant. Alors, ça leur a permis d'avoir une expérience très positive aussi, d'apprendre aussi, grâce à l'intervenant, comment on rencontre un chien, comment on se présente à un chien, les façons sécuritaires d'interagir avec un chien. Alors, ça désensibilise beaucoup aussi. Aujourd'hui, on a fait un peu de jeu médical. On a toujours la trousse médicale quand c'est approprié avec certains patients. Dans certains cas, l'enfant va profiter de cette occasion-là pour s'ouvrir parce qu'il se sent en confiance. Par rapport à la mobilisation aussi, des enfants qui refusent de se lever de leur lit, qui refusent de participer à toute activité, mais le chien, oui. Alors, des fois, c'est le chien ou l'intervention, la zoothérapie, qui va permettre à l'enfant, qui va donner assez envie à l'enfant de sortir de leur chambre, de faire une activité. Alors, il y a certains cas qu'un patient qui n'avait jamais voulu se lever depuis 2 semaines, puis c'est le chien qui a réussi à le faire lever, puis le lendemain, le patient était discharged. Ça leur donne un grand sens de sécurité. Puis ils se sentent acceptés aussi par l'animal. Alors, c'est extrêmement précieux pour beaucoup de ces patients-là.